Don't let little superficial things bother them. They're happy that somebody's trying to help them to relieve their pain or just to make them feel a little bit better. That's been my experience. It's sort of like all of the other things have been washed away, and they've reached a sort of a peaceful point. They may not be happy about it, but they've accepted it. And they like to be with their family. They want to see their spouse or their children or their grandchildren, and they just don't want to be in a lot of pain. That's what I've tended to see.
Meaning in people's lives, does that come up? I mean, I don't know anything about medicine, but I'd have to think that, like, if there's someone with a giant void in meaning in their life, I mean, even though you're a medical doctor, somehow a person who's energized with meaning in their life and a person who has a giant void, that must manifest itself in physical ways as well.
It can, yes. Either there isn't meaning in their life, or they are overwhelmed by all of the things around them so that they aren't really talking to their inner self. And yes, we have seen that manifest in many types of symptoms. And we try to work with those patients to develop some insight so that they can connect with their inner voice and then really sort of know what they want out of life. I think when you don't know what you want out of life and you don't have any idea of how to achieve that goal, that you're right, there can be a lot of difficulties. And that's what people talk about, the mind-body connection. When your mind and your body are connected, you can move forward as an organism. When there's some blockage or interference with that communication, there may be disease, there may be depression, there may be anything going on with you until you sort of work to bring that about. And it's hard. It's hard work. It's not easy work. We frequently refer people for psychological counseling as needed to help them really go into those issues. It may be something that happened in their childhood. It may have been an abusive marriage. You know, the husband may have beat them, or there might be some substance abuse, and until they come to grips with how that affects them, their body is reacting with different symptoms, because your body always knows when something's not right. And the problem is we often don't listen to our body. We're so busy, oh, I have to go and do this, I have to go here, I have to go there. We're just all running around, and sometimes you need to have some quiet time to reflect. How am I feeling about my life? And I don't mean in terms of your bank balance and things like that. I mean your life, your inner life, how you feel as a person on this planet. Because you can improve things for yourself, even if it's something small. It's very, very important. I read an article in Oprah about 2 months ago where they asked women to make a list of all the things that they do on a daily basis for a week, and then just look at that and see what they liked and didn't like. And the people, they were astounded that they were doing a lot of things they didn't like to do, didn't have to do. So just eliminating some of those things will free you up.
On the rational versus mystical spectrum, I mean, surely you'd have to be rational to be a doctor. Are you like all the way on the rational line, or where are you on that spectrum?
I think I'm somewhere in between.
Yeah.
I mean, I'm rational. I look for cause and effect, obviously in medicine. But I also know that there are things that happen that we can't explain. There are people who improve. You don't think they're going to improve, and they do, and they go on and they do really well. So I think that you have to look at a bit of both. And I think some people are more in touch with their spirit or their soul or whatever you want to call it than other people are.
Does your intuition help you as a doctor?
Yes, yes. Intuition is very important, because sometimes you can get a sense from someone that they're not telling you everything, that there's really something else that's bothering them, that they just don't feel comfortable discussing maybe with anybody, but you hope that at some point they will bring that up so that you can try to help them. But intuition is very important. I remember when I was an intern and the patients would come into the emergency room and we had to run and evaluate them very quickly. It's called triaging, evaluate them very quickly.
Yeah.
And a young lady had come in and she had many bruises and abrasions, and she gave us a story that she had fallen, and it was a very complex fall story. And I was with my resident, and we looked at each other, and our intuition and also looking at her told us that something else was going on. And so we took her out of the larger room into a little private room, and we said, we can tell something has happened to you. And she started crying. Her boyfriend had been beating her brutally for some time, and she was in so much fear of him, she didn't know what to do. But she was with a friend, and the friend had seen how she looked and had brought her to the emergency room. So intuition is extremely important, and paying attention to what the patient's telling you can really help you a lot.
Do you think the body affects the spirit more, than the mood, or the mood and the spirit, affects the body more?
That's a good question. And I think it may differ for certain people. I think it probably has a lot to do with how you process information. Because some people, they need to see something written, something cognitive, in order for it to go through their brain and then permeate into everything else. Other people are very good at feeling. Like they could be in a room with someone and they can feel that that person is having a bad time, or that that person is angry, but they can really feel it very strongly. So I think some people process information differently. And for people who are very in touch with other people's feelings, they need to be aware of that, and they have to schedule time where they're not around a lot of people to sort of recenter themselves.
Do you think it's more likely that depression causes physical disease, or that physical disease causes depression, or what do you think?
I think for many people, the depression is manifested by certain physical complaints, because the person isn't able to put that together, except totally, oh wow, I'm depressed. And it happens to all of us. I mean, we all go through phases where we have some depression or sadness, and you have to acknowledge it and do something about it before it really starts to affect your whole body, and before you really do become ill.
Do you sense that you're playing a parental role with many of your patients?
I think that there is probably a parental aspect to some of what we do, yes. But I really try to work in that team approach model. Because if you stay totally in the parent model, then that means that the patient can bring to you anything when they haven't done the work. So they need to do that homework. They need to be on that diet or exercising or taking that medication so that you can evaluate them and see if they're improving. If you're strictly in the parent-child mode, that's not totally healthy for a therapeutic relationship.
Have you had much experience with what I think is called psychosomatic illness, where someone comes to you because you're a doctor and they're complaining about various things, but what's going on is not really, in your estimation, a physical disease?
There is, yes, there is going to be some of that, certainly in someone who comes for acupuncture, because that person may have been to a variety of physicians, had many tests performed, and yet they still have a distinct complaint. So sometimes that is what you might consider psychosomatic. In the acupuncture world, we would consider that an imbalance in their chi, in their energy. So we try to find out what area is not working well and try to correct that. And it may be from a great variety of things. They may have back pain or neck pain, and now they have headaches. They have headaches that are awful. They don't respond to medication, blah, blah, blah. So, yes, so we see quite a bit of that.
I'll just be personal to allow it to introduce the question. I struggle with chronic fatigue for 20 years. And the most common response I get when people are being honest is, you sure it's not all in your head? And so I got to the point where I would tell people, if they were friends, there's nothing good out of you using that response to somebody.
Right.
So let's say it is all in their head. It's not going to come out because you then ask them, I'm sure it's not all
Right,
in your head.
exactly.
There's no good result that can come out of that question. So I guess that's my personal first-hand experience with it. So